is Robert Maniscalco. I'm an outreach athletic trainer responsible for the Northeast region at Memorial Hermann Sports Medicine.
And my name is David Wilkinson. I'm also an outreach athletic trainer for Memorial Hermann, and my area is the northwest side of Houston.
We're here today. We're going to talk a little bit about bracing, and in particular right now, ankle bracing, about the pros and cons, and some suggestions about bracing. There's different kinds of bracing that's going on. It's prophylactic and functional bracing. The difference there is prophylactic is more of a preventative type of brace. Functional is more of an active brace that's needed for an injury. David, I'll let you go ahead and just kind of start with kind of different types of braces. Then we'll compare bracing and taping later on.
Yeah, some of the things Robert and I see as we're out working events and things, we see some kids that wear kind of the elastic stretch braces, and those are fine to use to keep compression and swelling down when an injury occurs, but to wear as a functional brace when you're playing in competition and stuff, that's not very good because we're wanting something that supports the joint to keep it from re-injuring itself. So with the things that we've done in the past and have used, we kind of recommend using a lace-up brace and stuff. And a lot of that will depend on, there's not a particular brand that's granted stated as being better than the other. It's kind of a comfort and what's best for that athlete and what they feel most comfortable with, and that it does support and prevent that ankle from being injured again. Then as we also go, you can get into more advanced type braces that are made out of molded plastic and that can be kind of a custom fit and whatnot. One of the good things about braces when you use them is as they loosen up, you can stop, retighten them and whatnot, to where when they're being taping you can't retighten. You have to cut it off and then retighten it or retape it to give the support that it's needed.
Well, I think you brought up a good point too about the ankle bracing with the lace-up braces. But I think one thing is, I think it's important that a lot of people don't realize or forget about is when you're wearing ankle braces that lace up, you need to make sure you always wear the right one on the right leg and left on the left. And not that they come right and left, but once you start wearing it on one ankle, your ankle molds, so that brace molds to your ankle. So you don't want to constantly flip-flop it back and forth. You just want it to be on the same way. You're talking a little bit about taping. Thing about taping is a great concept. Thing that I remember about tape, though, a lot of times, within 30, 40 minutes, with all the sweat and everything and the Houston humidity, the tape is going to loosen up. So you're going to lose some of the protection that it may offer. If you have serious injuries, a lot of times you'll see taping and bracing going together, and just to help get the maximum effort out of it. Now that we've talked about ankle braces, we're going to move on to knee braces. Knee braces very similar to ankle braces. A lot of it's personal preference, physician preference. A lot of physicians will recommend specific type of braces that they've had success with. And then again, a lot of the braces are just prophylactic. There are many, many different kinds of braces out there. Anything from custom braces for ACLs to just your compression sleeve that you may wear. David, to start with, talk a little bit about the difference in just like a compression brace, like a patellar brace versus a just knee sleeve.
Yeah, when we've dealt with kids and stuff, a lot of times we'll use compression braces where a kid may have a little bit of swelling and irritation or tendonitis. Sometimes we might use the neoprene braces if a kid's having a patella tracking problem to help keep that patella in place so that it glides where it's supposed to and not cause irritation on the back. Kind of to reiterate, too, the braces have kind of advanced a lot in the last few years to where DonJoy and Bledsoe and some of these knee brace companies have started coming out with a generic type brace that you can buy off the shelf. So a lot of high school kids and stuff that play linemen and things, you'll see them starting to wear these braces to prevent knee injuries when other kids fall on them, blocking there in the line and stuff. So we've started seeing more kids use those, but they're not a custom brace. They're a generic brace that can be, the kids are measured according to their circumference of their thighs and calves and stuff, and then the brace is ordered as you would a ankle brace and things that come in small, medium, large, and extra large sizes.
Well, you see, you alluded to a little bit there when we're talking about the custom braces versus the off-the-shelf braces. A custom brace is one that is form-fitted for your body. The biggest problem with that is a lot of times especially the adolescent age where the kids are growing, they're going to grow out of that brace within a year or so, and they're costly braces where if you go with the off the shelf, most of those can be bent to an extent and they fit a judgment area like a small medium or medium large, something like that, where you can kind of expand it a little bit.
Right.
You see a lot of it at the collegiate level, NFL level, these especially like you was talking about the linemen wearing these braces. That doesn't necessarily mean all those guys are hurt. It's used more of a prophylactic if someone were to fall on them sideways to help prevent some valgus or varus stress on the knee. And then, David, I'm going to turn back over to you to talk a little bit about people with torn ACLs and the derotational braces and what some doctors and most doctors will tell their patients, kind of their views on the ACL braces.
Right. Depending on the doctor and his preference, some of those docs will order the custom brace for the athlete as they get 3 to 4 months out from surgery. Once that swelling has gone down and the quad starts to become muscular again, they'll get that measurement and fit that kid in a custom brace that's specifically for them and stuff. And then a lot of times those athletes will wear that for that first year, and then after that first year, most of the orthopedics will take them out of that brace where they just go without the brace and stuff. It's more preventative so that that ACL can get good and healed up and they don't have an issue if somebody falls or injures them during a contest or practice.
I think one of the biggest things to remember, too, about any type of brace, we're talking ankle braces or knee braces, is sometimes you have to go with the athlete comfort, too. And there's a lot of kids that they get an injury, and whether or not how much protection that brace gives them on the ankle or knee, sometimes it makes the individual feel more comfortable. And sometimes that's more important than the actual function of the brace.
And another thing with that, too, when you guys look at braces to get, if you're playing football in some of these sports, make sure that metal is not exposed because the referees are not going to let them wear that in their contest. Anytime there's metal on the brace and things, it has to be covered up so that it can't injure other players.
Talk a little more about the custom braces and how you go about getting a custom brace if that's something that is either needed or something that you desire. Custom braces most of the time are prescribed by your physician, and then what happens is the manufacturer of the company in most cases or a rep for that company actually has someone that will come out either to their school or to the doctor's office or even sometimes to the patient's house to take actual measurements depending on the type of brace, again, because there's just like everything else, we mentioned DonJoy a while ago, Bledsoe. That's just 2 of the braces that are out there where they actually come out and they take measurements and they specifically make the brace for whatever problem you have. They can arrange how much extension you have, how much flexion you can have. So all that has to be done though through the doctor's orders and the prescription that they may have. My name is Robert Maniscalco. I'm an outreach athletic trainer for Memorial Hermann Northeast, and we're the proud sponsor of Humble ISD as the official healthcare provider. If you ever have any questions about athletic injuries, you can always go to our app. It's a free app, Memorial Hermann Ironman, and go to the staff directory for Northeast and pull up my contact information with name, email, and phone number and give me a call.